Good morning, everybody. I want to thank you all for coming here. We want to talk, give the general public and population an update on the COVID-19 virus outbreak. Try to redefine what is going to be the normal, where we are, where we've been, where we're going, and how we're going to get there. So the economy's shot. Healthcare has been affected tremendously. People are scared. And, you know, they're looking for some advice and some answers. So today I've got Tammy Riley with the Pike County Health Department with me, Judge Executive Ray Jones, and Dr. Fadi from Pikeville Medical Center here to talk. I've got a couple of questions. And first of all, I want to thank you all for being here.
Thank you.
And,
Thank you.
and having this with me. So let's kind of go through an update, Dr. Fadi. You know, we know what the virus is, you know. We know how to deal with it as little as we have. We've had a couple of, 45, 60 days of experience with it. Let's get some updated numbers. How many confirmed cases are there? How many deaths are there? How many probable cases are there, which we're going to get into here in a minute, because there's a difference between a confirmed case and a probable case. So we want to kind of do that. Would you kind of expand on that for us, please?
Sure. So if I'm going to talk about Pikeville Medical Center, I'm going to Tammy to talk about Pike County. So we've done over 1,200 cases so far. We have 10 positive at Pikeville Medical Center, through three cases positive through Gravity, and 7 through LabCorp, UK, and Solaris. So we have 10 positive cases. Recently, we admitted a patient with pneumonia, and he's been released. So we've been seeing kind of steady, like rhythm at this point. I don't know if we're close to the peak or not, but we have seen more cases now as our testing capacity expands. And I'm going to basically here touch on testing and the importance of testing here. There are two importance of doing the testing. Number one, if you look at testing, each test result is a piece of puzzle. So we're talking about puzzle pieces. You need all these puzzle pieces together to have the full. Without having all these pieces, activity in this area. Two numbers here in this area. Number two, if you want to empower the public health, I need to have more testing. I need to have positive results. If I have positive results, I can ask them to isolate the patient, and then subsequently, they're going to do a lot of work tracing all the contact and quarantine these contacts. Without doing all these corners, what we call of the safety box, we cannot resume life. It's going to be the foundation. This is going to be the foundation of resuming safety down the road when we reopen.
All right, yeah, we're going to get into testing and the types of testing that's being done, where it's being done, how it's being done, and so on and so forth here in a few minutes. Tammy, can you kind of give us some statistics on who's been affected throughout the county? Men, women, children, infants, old, ethnicity, and so on and so forth?
Absolutely. And what we have found is that, from 20-year-olds to 70-year-olds, specifically in Pike County, I know across the state we've had infants up to 80, 90-year-olds be affected by COVID-19. Specifically to Pike County, we've had a fairly even spread from 20-year-olds to 70-year-olds. We've had a slightly propensity towards females, about 60% females. There's 14 of them, and 9 are male. So all age ranges, a slight prevalence for females over males. So we did find that. And then there's the asymptomatic, and something that I've watched and is find interesting is that as testing capacity has increased, which is a positive thing, we have found more asymptomatic. So there are more out there who are asymptomatic, and it's not just the 20-year-olds who are asymptomatic. We have found that prevalence of asymptomatic versus symptomatic goes from the 20-year-olds to the 70-year-olds. So we have 13 currently asymptomatic versus 10 symptomatic, but this is very concerning for me. I can elaborate on that.
Yeah, we're going to go into the differences there in a few minutes. So, but at this point, who's most vulnerable to get this disease? It seems like people in nursing homes have a higher mortality rate than the regular folks, and if that's the case, are there more strict guidelines with nursing homes and those kind of places that should be enforced? Doctor?
If you look at the number in Kentucky, like we have over 50% of the cases of mortality are coming from the nursing facility, long-term care facility. And this is to emphasize on the importance of that disease is attacking mainly the vulnerable ones. So more than 50% nursing home, we're talking about all these comorbidity from stroke to heart problem to lung disease. So these are the main concerning medical conditions that can lead to further complications down the road, as well as what's called ARDS, acute respiratory distress syndrome, and sepsis, septic shock, and multi-organ failure. However, what's disturbing me about that virus, it can attack any age, like 10-year-old on the ventilation. So it can attack any age, any person, because we still have a lot to know about the virus. So the virus will dock on receptors called ACE2 receptors. We call them the docking station. And once they dock on these receptors, they can get internalized inside the body. So we don't know who are the ones that have more of these receptors and whose is genetically susceptible for these viruses. So these are going to be subject to more studies down the road. But at this point, everybody can be at risk for COVID-19. Nobody knows who's going to be at risk for complications. In general, people with heart problem, lung problem, diabetes, obesity, and other medical conditions are at higher risk to catch the infection and having complications from that. And if you look at the number, more than 80% of mortality attacking people over the age of 60.
Right. Well, you bring up a good point. It seems like the virus affects everybody. It's affecting everybody from, children to, in their 80s, 90s, and so on. Some people who are perfectly healthy are dying. Some people who have underlying issues like that are okay. What is the science telling us about? What have we found out about why it's affecting and killing people who are in their 20s and 30s who are perfectly healthy, and some people who are in their 60s and 70s who are, have the underlying issues they're living? And, it doesn't seem like there's a fair balance of who it's attacking.
We don't know. That's what's disturbing us. But in general, it seems to be related to some genetic manifestations of a receptor called ACE2 receptor. Okay, so this receptor is playing a major role in putting the virus inside the cells and subsequently having replication. On top of that, if you look at the numbers in Kentucky and the rest of the world, we have a lot of hidden comorbidities. Diabetes and obesity are the leading coexisting medical condition leading to complications. And if you look at the data from New York, more than 2 medical conditions are very common even in young population. So I believe like there's some sort of underlying immune issues, underlying medical conditions, and this should be an eye-opener for the future. We need to have better lifestyle, to have to work on ourselves, have better medical conditions, and this is how you fight against the infection. So all these can lead to some sort of immune weakness. Although you're young, but your immunity is not strong and robust enough to fight the virus. So there is definitely something going on that we don't fully understand at this point, and is going to be subject for further studies.
Sure, thank you. The mortality rate is less than 2% at this point, and it seems like, the majority of the people have other issues or are in the nursing home and so on. This is kind of open to all three of you guys. Why the panic? Why is there the huge panic to shut the economy down? Why is there the huge panic to isolate? Why is there, if only 2% of the people are dying from this thing, talk to us about the panic. Tammy, I'll talk to you first, and then Ray, I'll talk to you about the economy.
Okay, well, globally, we're on almost 7% mortality rate. In Kentucky, we've maintained around very close to 5. We have lower to about 4.7% mortality rate, and then although our numbers, compared to state and national numbers, fortunately are low with 23 confirmed cases, we still, let's don't forget, have an 8% mortality rate in Pike County. We've lost 2 Pike County citizens. I don't want individuals to forget that. We have 9 individuals still under the care of health professionals and that are being monitored by public health. So we've had some growing cases since April 28th. Our mortality rate is actually very concerning.
Ray, I know you're getting phone calls about why can't we open the economy? Why can't we do this? How do we do this? What do you tell people about this? And I know that the naysayers and the non-believers are saying, it's a political thing. Open the economy, get people back to work, and so on. And we're going to talk about the hard economics, but talk to me about that issue now, please.
Well, as a county official in executive capacity, When we acted in a way that would be the most, or the least restrictive, but yet would protect public safety. We didn't want to be like New York. We didn't want to be like Italy. And there were people saying, well, Italy has an aging population. Well, New York is one of the largest economies in the world in and of itself. They have, the best of everything in New York. And we see how many people, they've had, I think, 26,000 plus deaths in New York. I believe that the social distancing restrictions that were put in place are one of the reasons that we only have 23 cases here. But here's what concerns me, Jeff. I mean, my business has been affected, my law practice, every business has been affected. We're going to be years recovering from this. It's not a political thing to affect the upcoming election. If we had had the outbreak here that we could have had without the social distancing and the restrictions, it could have been horrific. We have an aging population, people like my dad, my mother-in-law. I mean, every family has a family member that has some underlying health condition or an aging person in their family. But we see today the newspaper in Lexington talking about a 10-year-old on a ventilator. I have young children. Dr. Fadi has young children. I mean, this is a disease that no one can predict how it's going to affect the person that catches it. I think that Governor Beshear, I think that the federal government, I think that the local governments across Kentucky have acted to save lives. And, you can second guess this all you want. What I'm concerned with is as the economy opens back up, and it has to open back up, a phased approach, I think, is a logical way to do that. But as it opens up, you're going to see what happened in Georgia and Tennessee. You're going to see a resurgence of cases. And we're going to have to be prepared to even make changes to the reopening guidelines if necessary, or implement further restrictions if we see a substantial number of cases. I'm concerned about school opening back up in the fall. I'm concerned about whether I would even send my children back into a public school when you pick up the newspaper and you see a 10-year-old on a ventilator. I've got an 11-year-old daughter. I mean, no one can predict this. We have copies of all the guidelines here in the judge's office. We're going to distribute those to all the funeral homes. There's a lot of churches in Pike County. If they will call us, the guidelines for the places of worship, those were changed on May 9th. I can run through these real quick if you like, Jeff.
Well, I'm going to get into reopening the economy here in a little while. I want to get more into the science of it and the actual virus, but in a few minutes we'll get right into the economy if that's okay, and then the reopening of the economy. So, let's talk about something positive. People have been affected, okay? The economy is in the dumps. Let's talk about people who have recovered. How many people had it who have recovered? Where are they now? And is there a possibility of reinfection? So can you talk about the recovery?
I'll talk about the recovery. I'll certainly let Dr. Fadi talk about reinfection. And what I would like to add, technically here in Pike County, we have 12. 12 of the 23 have recovered. We do have the 2 who are deceased. And then we have the 9 that are continuing under our care. But one of the things you were talking about New York and the numbers there and their economy, and what I would like to remind us here in Eastern Kentucky is that we are not densely populated like New York and New Jersey. Over half the deaths actually in the United States, or very close to half the deaths, which were a little over 80,000, are attributed to New York and New Jersey, but they're very densely populated there. We have that advantage that we're not, this is the good news. You wanted to talk about something positive. We are protected in some ways by our mountains. We are protected by the rural nature of our geography. So that is a positive for us. We are not densely populated. Dr. Stack, our Commissioner of Public Health, said very wisely, if you're in rural Kentucky, why would you take that, when you congregate, like at the big retail stores, when you congregate in the parks, and you're not following good social distancing practices, you purposefully remove that advantage. So all that I've been asking, and I think the public for the most part has complied and listened because we care about each other here in Pike County. People have worn their cloth masks and practiced good social distancing. So for the most part, we have taken advantage of our advantage of not being densely populated. So it's easier here to practice good social distancing if we will only listen and comply, which most people have.
Fantastic. Dr. Fadi, 55% of people have survived and recovered. Is there a possibility of getting reinfected?
So that's a good question. So this is a novel virus, which is something new. Our body, our immune system, never been exposed to that. So for the first time, when you get exposed to the virus, your body is going to generate what's called immune activity. And you have two forms of immune activity, the innate and the mediated one. So when you're infected, you're going to basically develop some sort of antibodies, and you mobilize some of these molecules and the cells to attack the virus. And once you're over that infection, your body has antibodies called IgM and IgG. Usually IgM is a marker of active infection. However, down the road, in 3 to 4 weeks, you develop what's called IgG, which is called seroconversion. In other terms, this is when your body is over the infection and you have immunity. We don't have a clear data about how long that immunity is going to last, but at least we know from prior studies from other coronavirus at least 1 year. We call it short-term immunity. In general, if you develop that immunoglobulin IgG, you have some sort of protection to fight against this infection again, because your body has what's called memory cells, and these memory cells, once you're in contact with that virus again, will develop immediately the antibodies to stop it from attacking your cells. So in general, this is the theory at this point, you have some sort of protection once you're over that infection. But let me give you an idea now. We've done some tests in the Pike Medical Center. We can tell you for sure that this virus is new to the area. I've done more than 400 tests on our employees, and we have only 2 IgG positive, which means this virus absolutely new to our area, and we don't have what's called herd immunity here in this area. So people, they say we have it since January, since February. This is not true. This is something new that start to manifest at this point.
Are you afraid of, or the infection control disease people in the CDC, are you afraid that all the sanitizing, all the hand washing is going to lower our immunity and make us more susceptible to other diseases down the road?
I don't think so. These are wonderful weapons to protect you from viruses. And here I'm going to take the opportunity to touch on 2 different aspects of cleaning. We call cleaning and sanitizing. Cleaning, which means that you clean all the dirt or visible soil from a surface. However, sanitizing, or this is going to be a different process. You need to use alcohol, 70%, or you need to use the bleach to take most of the microorganism or the bacteria or viruses from the surface. Doing this is going to protect you and mitigate the spread. This is not going to lower your immune system. Your immune system based on how much immune cells and how much functioning you have in your body. This is not going to lower your immune system. What lowers your immune system? The stress, the comorbidities, and not taking care of yourself. If you work on all these, this is going to boost your immune system and make you more capable of fighting infection. The bleach is not going to make your immune system like weak. Alcohol cleaning is not going to make your immune system weak. So we need to do all these to mitigate the process. On the top of that, social distancing is a great tool. I'm not against going back to what's called the new norm. We have to go to the new norm. We've been sheltering ourselves for many weeks, and this is the time to go to the offense. We need to resume some sort of life. However, keep in mind that virus is everywhere, is sweeping the whole country and the nation. So we have to be a little bit careful and diligent and do everything safe, and social distancing continues to be the safest and the strongest weapon to strive the virus from any physical interaction to spread from one person to another person. And I've talked several times about the R0, which is the infectivity marker, and we said this is 2.2. However, you can manipulate that marker easily by cutting down interactions, because that virus is based on interactions. The more you create physical interaction, the more you create opportunity to spread and multiplicate. The more you keep that 6-foot physical separation, the lower will be the spread of the infection.
All right, we're going to get into kind of that when we talk about reopening the economy here in a little while. Tammy, can you explain the difference between a confirmed case and what is being considered a probable case, please?
Yes, it's a classification for COVID-19, and when we have a confirmed case, that means the individual has tested positive for the PCR testing. That's the nasopharyngeal swab type of collection. and I know Dr. Fadi can go into much more detail on the science behind the PCR testing. That's an amplification methodology. But that's what we're very accustomed to. This is similar to the flu collection when we go for an influenza test. When we test positive for that test, that's confirmed. That's an FDA-approved test and is confirmed and reportable to the state. Probable deals with antibody testing, which this is a novel coronavirus, so this is a new virus. So it's antibody testing, but it's not just positive for the IgG or the IgM, which again, Dr. Fadi can get into, but you've tested positive for an antibody, antigen, with the virus, but you've also have one clinical criteria or an epidemiological linkage. That means you have fever, headache, chills, 2 of those, malaise, some other symptoms, or shortness of breath or tightness in the chest. So you have a clinical criteria and or an epidemiological link with the antibody testing. That's considered probable, and we are now reporting that in the surveillance system. So that goes to the state and is reportable. And we treat those cases, because it's helpful to do so, we treat those cases the same as we would a confirmed case. We contact them. There's the epidemiologist does the interviewing. We contact their direct contacts and do the isolation quarantine and work with them in the community to mitigate spread.
All right, thank you. Dr. Fadi, Tammy, Judge, have we reached a plateau in Eastern Kentucky? And I saw in a slide presentation somewhere that July through September, we could expect the second and third peaks. How are those peaks projected to be not as high as the first initial one? Is that because, people have already been infected already, or are we expecting less infection going forward, like through July and August and September?
To reach a plateau, you need to have what's called a growth factor to be 1 or less. And I'm going to explain that again. Growth factor, it's a number of new cases today equal or less than the day before. As long as you don't reach that kind of number, you're not in a plateau. And if you can look at Kentucky, there is what's called fluctuation of the number. One day is over 600 cases, one day is 100 cases. So we still have a fluctuation of the curve when it comes to the new cases. So I don't know. So are we in the plateau or not? It's very hard to tell at this point with that kind of fluctuation of new cases, because I need a constant, a steady number to be at least equal to the day before or less than that to be able to reach the plateau. But if you look at the United States in general and the world in general, yes, from epidemiological standpoint, we are in the plateau phase. In Kentucky, it's a little bit challenging because of that fluctuation on a daily basis. Now, we're projecting to do over 33,000 testing per week, and this is definitely going to expand the number of cases, and this will give us a little bit better idea about how is this number fluctuating in the next few weeks.
All right, let's get into the testing. What are we finding about the testing? What type of testing is available? What's the difference? And why is testing so important at this point?
Okay, so we have 2 different modalities of testing. The first one, which is the backbone of making any diagnosis of any COVID-19, we call them the molecular test or nucleic test amplification, or PCR. So this test is still the gold standard to make a diagnosis of COVID-19. This test is extremely specific in a way, which means if you're positive for COVID-19 nasopharyngeal swab or any kind of PCR, this is without any doubt that you have the infection, because that test is based on taking a piece of the gene from the virus and amplify that virus, that nucleic materials. And if you test positive, which means that you have a perfect match with that kind of like test, and this is definitely positive. The problem with this test is not 100% positive all the time, and this is related to several factors. Number one, the timing of doing the test. So what time during that illness you perform the testing. And usually most of the yield is coming within the first week of the illness. If you do the test within the first week of the illness, your yield to get positive results is going to be the highest. And then after that, the RNA concentration in your nasopharyngeal area is going to slow down and subsequently make the test very hard for it to test positive. So the best timing to get positive test is going to be the first week. Number two, it depends on the site of collection. So if I go to the nostril, your test is not going to be as good as going to the nasopharyngeal area or go straight to the lung. So that's why we go, even during our drive-through testing, we go to the nasopharyngeal area. This is going to give you a little bit better accuracy when it comes to the yield of the virus. So all these factors definitely can affect the molecular test. Now, on the top of that, we have another test. It's called serology or antibodies. And serology antibodies are part of the result of your immune system when they fight against the infection. Usually IgM, we call them acute phase reactant of the virus infection. So after the first week of the infection, day 7, you start build what's called IgM. And that IgM will continue to grow and then will leave the body up to 3 weeks to 4 weeks. In the meantime, your immune system is building what's called permanent immunity, which is the IgG. And that IgG will increase at day number 14 and go through positive for a long time. So this is how your immune system, it works. So the serology, in my opinion, is a great, I will say, adjunct testing for COVID-19. I don't think this is a perfect testing for acute infection. And I still believe that PCR is still the gold standard to make a diagnosis of COVID-19, while serology will give you a historical data about what's going on. For example, when I do testing for 400, 500 patients, and I see only 2 patients having only IgG positive, I can tell you that this virus is new here. There is not much herd immunity here, which means we never get this virus before. So this is something new, and we're starting to get infection here in this area.
Walk me through the process of getting tested. Who's supposed to get tested? You know, if they're showing signs, symptoms of this, should they self-quarantine? If you get tested, should you quarantine yourself until you get the results back? And you know, just walk me through that process.
Well, that's a good question, Jeff, and it really depends if you're symptomatic or not. And we do have greater testing capacity now in Pike County, so more people do have availability of the test. You know, even as mid-March, I can think back, that was not that long ago. Really, we only had testing capacity for those who were very sick. I mean, they were in the hospital, and doctors like Dr. Fadi were ordering those tests, and that was the only availability we have. Now we have private providers. We have the Pikeville Medical Center drive-through. It's open Tuesday through Friday. About 125 tests per day are available. We do encourage those with mild symptoms to go get a test. If you are symptomatic, Public Health would ask that you monitor your symptoms and stay home. If you're a healthcare professional, the guidelines are slightly different. If you're asymptomatic and you're just returning to work, or you're asymptomatic and because we are facing the economy, we do ask people, go get a test. If you want a test, go get a test. Symptoms are not required now for testing. For some locations, you can go to the drive-through. Again, if you're returning to work, go get a test. It's not required that you quarantine. If you are, there's a lot of, anyone who would want, like churches would be another good example. If you're a pastor of a church and you know that you're going to be interacting now with your congregation and you haven't had a test, I would highly recommend that you go get a test. If I had an employee who came to me and said, I have symptoms, then I would say, go home, get a test, we'll wait on the results, and then we'll go from there. So it just depends. Every situation's a little different.
So would you say the rule of thumb would be that if somebody is showing symptoms, shortness of breath, high fever, coughing, sneezing, runny nose, and they go get tested, should they self-quarantine versus the person who just is curious and wants to go get the test?
Yes, those with symptoms should quarantine.
Okay.
Absolutely. But if you're asymptomatic, it's not necessary for you to quarantine. In other words, you're a pastor and you know that you're going to be mixing with your congregation in the near future, and you're looking at phasing in back to, your employees back to work, and you're a manager or you're an employee and you're returning to work next week, for example, or maybe this week, the 11th, did mark a big day for us for the economy, Judge, as I'm sure you know. So those individuals, have availability of testing if they want it, so they definitely should go get a test, but quarantining is not necessary. Now, once someone tests positive, those individuals in their direct contact, that's a different scenario, which I can elaborate on.
We're going to get into that here in a second. Judge,
So let me just comment on that. You made a great point here. The problem is what's called the silent transmission. So these are the asymptomatic patients.
Yeah, I want to get into the difference between asymptomatic and symptomatic, but I have one more thing before I do, and I want to ask the judge. Judge, you know, we're hearing about the testing. We know that Pikeville Medical Center has got a very valid, credible testing system. We're seeing pop-up systems throughout the area. If people have questions about the credibility or the validity of pop-up testing sites and facilities, and, you know, older folks are being taken advantage of, can they call your office and can you direct them as part of your responsibility of keeping this community safe in conjunction with the health department and Pikeville Medical Center?
We can. I would recommend that if you're wanting to be tested, first contact either Pikeville Medical Center or Tug Valley ARH or one of the ARH facilities, because those are the two primary health care providers in our county, or call the health department. The United States Attorney's Office, U.S. Attorney Rob Duncan, they have created a task force to monitor pop-up testing to make sure it's not fraudulent. And as you know, anytime there's some type of national emergency, people will try to take advantage of that. The gravity testing, the UK testing, the testing that's done through the hospitals, and as far as I know, the Kroger testing was all, you know, above board. So, but if you do have questions, please make sure you call either Pikeville Medical Center, Tug Valley, or the health department.
Very good, thank you. Is the testing free, and what's the time frame on getting results?
The testing is free, and it depends on where you go, like the Pikeville Medical drive-through. That is a partnership with the Health Department and Pikeville Medical Center, and we utilize gravity diagnostics. So their turnaround's 24 to 48 hours, but then it depends if you're there, you know, late on a Friday. So the timing can also affect, you know, how quickly the results are returned. And there's private providers out there that are also doing some testing. But you can also go to kycovid19.ky.gov, and there's a link on there that will direct you to all the test sites across the state of Kentucky. Those are all valid. We talk a lot about remaining calm in the 5C plan, and part of calm is getting your information from reliable resources like your government, Pikeville Medical Center, your public health, or like kycovid19.ky.gov. But all of those test sites are listed there, and some of them do require that you be symptomatic. So there are test sites where the priority level 1 and 2 are required, whereas others are open more to help with the rephasing of the economy and the government.
Doc, here's the million-dollar question. What's the difference between being symptomatic and asymptomatic? We're hearing a lot about that.
So symptomatic, which means that you're showing some sort of symptoms, and Mr. Riley already went over some of these clinical manifestations. You can have like fevers, muscle ache, joint pain, runny nose, change of smell or taste, and now we've seen a lot of gastrointestinal manifestation like diarrhea as the only manifestation of COVID-19. In severe cases, you're going to have severe lung infection and difficulty breathing, and some people, unfortunately, 5% are going to be ending in a critical situation, and some of them on mechanical ventilation. So these are the most common clinical presentation of COVID-19. However, if you look at the data, 25% of patients, they can have it only in their upper respiratory, and they don't show any kind of symptoms. They're fully asymptomatic, and this is the danger about having asymptomatic patients, because they can go to the public and can spread it inadvertently to other people without knowing. So they're naive. They don't know anything about the virus. And that's why we emphasize on widespread testing for everybody, even if you have no symptoms. Just do the test. And this can help us tremendously to reopen life safely, because if I can capture a patient who is asymptomatic spreader, I can stop that person, trace the contact, and mitigate the spread of the infection. This is what's important, and this is what's disturbing about this virus, because we need to capture more of these asymptomatic people to further mitigate the spread process.
Dr. Fadi made a really good point, and I really want to jump in here and add something, because I certainly would not want to misspeak. And when I said earlier, if you're asymptomatic and you test, you don't need to quarantine. But there's a big however. However, like all of us should be doing, especially if you get a test, you should be monitoring your symptoms. You should be practicing social distancing. You should be wearing your cloth mask when you're in public. We should all, but especially if you've tested, you should be taking extreme precautions, because if you're asymptomatic, you could still be spreading it in our community. And that's where my concern is, because 13 out of 23 of our current, of our total cases in Pike County have been asymptomatic, and that number seems to be climbing. That's very concerning for me when I go out on the weekend. I drive around and monitor, and I see that, and what appears to me is that we may be relaxing our behaviors. So that's quite concerning for me. And asymptomatic can transmit the same as symptomatic, correct, Dr. Fadi?
Yes. And anyway, if you want to practice your civic duty and you're really concerned about the economy and about reopening, be part of the solution. If you want to be part of the solution, this is a free test. Please go and do the test. However, you have to be responsible of the ramification of the test. So that's the point of doing the test. If you're doing the test, you have to be responsible for, if the test comes back positive, you have to quarantine yourself for 10, 14 days. So you need to do your civic duty to mitigate the spread and stop the infection here in this area. So there's definitely some societal duty of doing the test, and I encourage everybody to be part of the solution to reopen life safely.
So boxing in the virus, as you talked about earlier, and making sure that you get tested, and if you do get tested and you are positive, you must be prepared to self-quarantine for at least a minimum of 14
And
days.
I tested myself, and I was basically ready for all the consequences of having any kind of positive results or not. So this is how you show you're part of solving the problem in this area. Test yourself. If you're positive, quarantine yourself, stop the spread, and the more you cut down and strive the virus, the better is going to be the outcome, and the safer will be the reopening of life and economy here in this area.
How often should somebody get tested, and how many times can you get tested? Somebody could be negative today, get infected tomorrow, get a negative response back today, and then 2 days later they could be infected. How often should people get tested?
You made a great point here, because I want to basically address to the public that if you have negative PCR, doesn't give you any security that you're not going to catch the infection down the road. This is number one. Number two, if you're negative, doesn't mean that you don't have the virus. So sometimes we repeat the test to make sure that you have the infection positive or not. For example, if you have somebody who has symptoms and you don't have any other explanation for these symptoms, sometimes we repeat the test within a day or so to make sure that we're not dealing with COVID-19. Again, take advantage of that free drive-through. If you're first time negative, if your physician is still concerned about your symptoms, you can do another one. That's the purpose of having continuous drive-through testing here in this area. And that's what we've been fighting. All the leaders here, we are trying to address all the complexities of COVID-19. And the major complexity of COVID-19 was the lack of testing. And that's what we brought here. It was collaborative effort. PMC, Health Department, Judge working like tremendously on that part as well. All the leaders, the mayor, in addition to you, Pike, all of us were working hard on solving problems here. And that drive-through testing was phenomenal and impactful for reopening safely. So we have that opportunity for free. So please take advantage of it. Get yourself tested. If you feel that you don't believe in the first test and you think that you have symptoms that nobody can explain that, you can do another test. It is, again, for free. And please exhaust this resource. That's the point of having a free drive-through testing, to have one, epidemiological data about what's going on here in this area. Number two, open safely. And this is basically the purpose of having the drive-through testing.
Very good. Once somebody is tested positive, there's a protocol. Who's responsible for contacting that person to say, you've tested positive? You have to quarantine. Who's responsible for doing that and making sure that they quarantine? And then what happens? What we call contact tracing. Who does that contact tracing, and how does that work? So Tammy, can you kind of help on that?
Yes, and I would like for the public to understand this. And Dr. Fadi mentioned, be prepared for the consequences. So, if you do test positive, again, we're back to that civic duty, and there are some steps and actions that are necessary to keep everyone safe and also keep the patients safe and their family members and contacts. So what happens is, first and foremost, the healthcare provider is going to notify the patient that they've tested positive and explain the test results. And then Stephanie Bentley, who's the nurse administrator at the Pike County Health Department, many years of experience, and she's reported diseases and communicable diseases for many years, and worked with like HIV, Hep A. But this is new to all of us. But she's the primary individual after the healthcare provider. She will notify the patient, And then she and the regional epidemiologist, and there's a team of them, and we all look at it, but they primarily, Stephanie contacts them. She does a thorough interview with the patient to find out if, like, how much interaction they've had. So that's why I'm saying, like, if you're following your good, social distancing, you're following the 5C plan, when we call you and we interview you, there should not be that many people that you have had sustained interaction. And sustained interaction means 10 to 30 minutes or longer, and it depends on what's occurred. So there's a thorough interview, and we determine at that time how many contacts, and we contact those direct contacts. And they're also given quarantine orders. And so it depends on the patient if they're symptomatic or asymptomatic. If you're symptomatic, we go by the date of the onset of symptoms, and if you're asymptomatic, we go by the date that the test came back positive. So that starts the clock ticking for a 10-day period. Now, the CDC has actually updated their guidelines to a 10-day period. But during those 10-day periods, say if you're asymptomatic, or even if you're symptomatic and the symptoms worsen, then that's where the nurse administrator would work with the healthcare provider and the epidemiologist. And there have been some cases, very few, but we've had to extend that time. And then during that time, we are monitoring daily, working with their direct contacts. So that's how that works. And if you're a healthcare provider, there's some slight modifications. And when you return to work, if you're a healthcare provider, there's some slight modifications. And then I'm sure Pikeville Medical and like Tug Valley, for example, have their own internal policies. But there are specific guidelines for healthcare providers. But if you're out there in the public and you've taken a test and it comes back positive, we work with you. We're compassionate. We try to give you the information, make you comfortable, answer your questions. We have 24/7 access to us with our after-hour call system. So we really help the public and guide them through the quarantine.
And after the quarantine period, the patient who was infected is required to take another test to make sure that they're free and clear. Is that correct?
Not necessarily anymore. That was early on with the novel coronavirus. There were like a follow-up testing that was required. We've relaxed, though. The CDC has relaxed those guidelines.
Okay. Hey, Dr. Fadi.
I want to
go
touch
ahead,
on the
please.
duration and exposure. So in public, if you're in contact with somebody with COVID-19, possible or confirmed, we're talking about 10 to 30 minutes exposure. In the healthcare setting, we're talking about just a few minutes.
That's true.
So I want to make that difference very clear. So if you're in a healthcare facility, when you have a lot conglomerate of healthcare professional like behavioral institution or recreation, like correctional institution, all these will put you in few minutes time frame exposure. So in public, 10 to 30 minutes. In healthcare setting, we are talking only about few minutes of exposure.
A good example is if we have a positive patient, Stephanie Bentley would work very closely with Nina Reynolds, the director for infection control for Pikeville Medical, just as one example. And then they would discuss and determine which healthcare workers had been in contact with the patient. And then Nina works with Stephanie for monitoring and determining who those healthcare workers are.
Very good. Dr. Fadi, there's treatments out there that are being tested. There's remdesivir and oxyhydrochloroquine and stuff like that. Are they working, and have you experimented with any of that at this point?
Sure. If you look at the treatment for COVID-19, I will put them into two different buckets. We talked about the antiviral buckets and the anti-inflammatory buckets. I think the one you're talking about is mainly the antiviral treatment. So remdesivir has been shown recently that it has activity against the virus. So this was the first randomized controlled trial. And I want to explain to the public what does it mean. When you study a medication, it's much better to pick two different groups of patients. And you follow these two groups based on the treatment regimen. So when we talk about randomized controlled trials, so we don't give nothing to the first group, and we give the medication for the second group, and we'll follow the outcome. So in the remdesivir randomized controlled trial, we've seen there is some sort of activity, and that medication decreased the length of stay in the hospital by 4 days, 15 days versus 11 days. We're talking about 31% decrease in the length of stay, which is big achievement, because if I can free a room in the ICU in the hospital and let other patients go to that room, it's a wonderful job. Unfortunately, this study never showed a great significant impact on mortality so far. So they're doing more study now to see what's the impact on mortality, but I believe this is going to work And there is some study going on at this point to show that. The hydroxychloroquine has been done in non-randomized studies. So we call them anecdotal studies, which mean that you pick only one group of patients, you give them the same treatment, and you make the math. So this is showing that will decrease the shedding, which is absolutely helpful. And in one study in Europe, it showed the decreased mortality and improved the outcome on patient up to 100%, especially if you combine it with azithromycin. The problem is you have to be very careful with the type of patient you're dealing with, because if I'm dealing with somebody who has some heart issue and they have what's called QT prolongation, which is something on the EKG that you can calculate, and if you add these medications to them, what are you going to do? You're going to push that interval a little bit longer, and subsequently these people can suffer death because of some sort of arrhythmia or irregular heartbeat. We don't want that. So these medications should be given by professionals to make sure they have no consequences when it comes to the treatment. So this is extremely important. But let me go back to the point here, what's important. Anytime we're talking about treatment for any kind of virus, you need to initiate treatment as early as possible. And I give you a perfect example. This is the flu situation. When I give treatment for flu within the first few 6 hours from the illness, I can decrease the length of and duration of illness by 4 days. If I don't give the medication, what's called the Tamiflu, for 2 days, I can decrease only the duration of illness by 1 day. So intervening is very important when it comes to the viral illness, and this will block all the cytokine storm and all the consequences of the viral interaction with your cells and all the clinical manifestations. So we are in the process of doing all that. We are studying now, if you do hydroxychloroquine or other medication early, what's going to be the consequences? So I'm waiting for these results to show up, because this is going to be so beneficial to us to see, can we do prophylaxis for people? If I start early, when I have exposure, can I give this medication? What's going to be the impact down the road? All these going to be very important data to follow down the road. But people, they're talking about vitamin C, vitamin D, melatonin, and other stuff. We don't know. So all these just ideas, and we don't have any solid foundation to say, yeah, they're going to work or not.
So the science has not proven that any of that stuff has worked yet, but they are testing those medications along with the vitamin C, the zinc, and all that other stuff to see if anything is working. And it could work very well in patient A, but patient B, it could be more deadly.
I believe the key here, if you start intervening early or not, this is going to be probably the most important factor here. But remdesivir is the first medication showing that there is antiviral activity in randomized controlled trial.
We talk about getting a vaccine. Is it too early to have a vaccine right now? Vaccines take years and years to develop. And, people either out of religious beliefs or out of the anti-vaxxers, they say, I don't want to get a vaccine for anything. How are we going to address that going forward when a vaccine does become available?
So the vaccine will take a few months, usually takes somewhere between 12 months to 18 months to be finalized and widely distributed. And I believe Johnson & Johnson in the process of doing that should go through phase 1, phase 2, phase 3 trial, because we have to make sure that, number 1, effective, number 2, safe for people, and they provide the right immunity. And vaccine, it works the same way like exposing yourself to the virus. So once you expose yourself to the virus, you have what's called seroconversion, also called the IgG, and the concept of giving vaccine is to give you an antigen in your body to boost your immunity and develop that kind of antibodies to protect yourself down the road. It's going to be probably the best option, but we need to wait on further study to show, yes, this is working well. Now, can I push it for everybody? Again, we are in the United States. This is a free country. We can show the data. This is going to be beneficial if the studies will show that. And definitely we encourage that as infectious disease specialists and immunologists. We encourage for vaccination, because this is going to be a wonderful tool to give you some sort of immunity and prevent all the complications down the road. The same thing like flu, the same thing like measles, the same thing like mumps, all these like vaccinations showing benefit and efficacy. So why not when it comes to coronavirus?
Sure. We're hearing that this virus has a mutation that's even more deadly. First of all, is there any truth to that? And we're also hearing that children, we talked about Judge Jones talked about the 10-year-old on a ventilator. Kids are contracting a mysterious illness that's allegedly related to COVID. Are we seeing that here in Eastern Kentucky? And what's your fear or concerns regarding that?
So this is, all the studies show this is not mutating. And there are many studies published that show the virus is genetically very stable. You can have a little bit of variation, but in general, it's very stable and much more stable than the flu, because the flu, you have what's called shift and drift. And that's why every year we have to do, like every year or so, we have to do new vaccine for the influenza because of all these constant changes in the genetic materials. We believe that coronavirus is much more stable genetically compared to the other viruses. And once you develop a vaccine, this is going to last a little bit for longer. So I don't think there is a mutation at this point. And I think this is all not based on any solid foundation or evidence-based science at this point.
What about the mysterious illness that the children are allegedly getting through this COVID thing? Is that, can we expect to see that here?
I don't know about what's mysterious illness, but think about it, that kids are much more prone and subject to have infections from any kind of infection. And on top of that, COVID-19 can come as well with other viruses. We call them the co-infections. If you look at some of the studies in California, you have 10, 20%, they have other viruses at the same time of COVID-19. Here, the question, are we dealing only with COVID-19 by itself, or there is something else, underlying illness or underlying infection, causing all the other problems related to this kind of mysterious illness? We don't know. So we need to see more studies showing, did they do all the workup needed? Did they explore other options? So all these will help us to determine that these complications are mainly from COVID or from something else or from the combination. But clearly, I can tell you this can be deadly. There's no question about that. COVID-19 can kill people by what's called ARDS, acute respiratory distress syndrome, and that disease can affect anybody, can affect any age. That virus does not discriminate between age group, ethnicity, race, like borders.
Sex, creed, color, anything like that.
Doesn't discriminate anybody.
It's not discriminate.
And this can affect anybody. Usually kids are more protected because the immune system a little bit better, but sometimes you can pick a kid who has some sort of immunity problem, what's called common variable immunodeficiency, some immunity issues, and unfortunately they can suffer the consequences of severe illness from COVID-19.
Yeah, it sure is tragic. Ray, you know, we hear about the technology that's out there that for contact tracing. Our cell phones now have apps on it, so that if I'm within 6 feet of you and I am infected, then my cell phone can send you an app that say that you need to go test it because Jeff Vanderbeck was close to you and he tested positive. You know, I know you're the judge executive, but you're a lawyer by trade. Is that an invasion of our privacy, and how do you feel about that going forward?
I would think it would be. Israel did that. Israel's government.
And South Korea?
You know, they can do that at the federal level much easier than we could. I think there are serious privacy issues with doing that. We have no way to do that at the local or state level. There are federal privacy laws, FCC regulations that would limit access to that data. And I'm not sure it's even viable to do that. We've got an epidemiologist at the health department that has been doing all the contact tracing. And, you know, we're really lucky that we do have a regional epidemiologist that's based here. And that's a huge asset for the health department and our healthcare professionals in tracing these contacts. But I would have serious constitutional concerns about accessing cell phone data of that magnitude.
Sure.
That would be, to me, a last resort.
You know, we're trying to reopen the economy. The benchmark that the governor said is at 14 days with decreased cases. We're increasing our testing ability now, which means we're going to see more increased cases. The state is seeing more increased cases. Are we opening up the economy too soon?
Again, going back to the numbers, so the more testing you do, the better is going to be the numbers, and you can see the picture much clearer. And again, as I told you, this problem is about puzzle pieces. The more you have these pieces, the clearer will be the picture. So the more we test, we'll be able to figure out down the road, probably in 7 days or 14 days, where we are exactly from that curve. If we're in that plateau or this curve coming down, that's not a bad idea. But if you continue to see constant increase, then it's going to be a little bit alarming for us. So I think the picture will be clearer in probably in 10, 14 days.
You know, are we just prolonging the inevitable where once we do open up the economy little by little and we get back to normal, or what is the new normal mid-June, are we going to, see just a lot of people become more infected because, we can't police people. We're going to get into how we're going to try to get the stuff from your perspective, right? But we can't police people to wear the masks, to stay 6 feet apart from each other, to not go out. You see it in all over the country, these crazy kooks out there doing stuff. They're doing push-ups in front of a building because they want their health department back open. Haircutting places, Lord knows we need them. I look like a mess, but how do we police the fact that your hairdresser, your health club is going to follow the guidelines so that we do this? And are we just prolonging the inevitable? Tammy?
It'll be a major setback if we don't comply. And so that's the main point. We must comply. And that's why I'm concerned over the last, it's trending as we're contact tracing. The last few cases is that we're seeing more and more contacts. Earlier on, it was like 2 contacts, 3 contacts. Now we're talking about 15, 16 contacts per person. If that continues, and that's what I want the public to understand, if that continues, then this reopening, there'll be a huge setback. There's no doubt. Because we've had 3 recently. If those 3 people have infected 2 other people, we're talking about 9 people just from those last 3 people. Correct, Dr. Fadi?
Correct.
So in order to slow that, so that the economy can reopen, so that when July 1 gets here, that's our last date, judges, it shows bars in groups of 50 or less. If we want to get to July 1, before the 4th of July, then everyone has to be on Team Pike County. Everyone has to wear these. Everyone has to practice good social distancing. So if you do test positive and Stephanie Bentley calls you from public health and starts interviewing you, and your contacts are, my contact may not be you today, Jeff. We've stayed 6 feet apart. When we get up and we move out of this room, any chance of us being within 6 feet of each other, we'll have our mask on. So we've complied. Then I don't need to put Jeff Vanderbeck down on my sustained interaction list. So you're not at risk.
We'll start talking if that happened.
Well, they might, but anywho, that's another topic for another day, Jeff.
Right.
So I will take Tammy's analogy all the time. We're halftime. However, we're losing against the virus. So we are down by 20 points. We are not up by 20 points. So to be able to go to the new norm, we need to improve our offense, but we cannot let our guards down.
Right.
So we need to keep our guards doing a good job to be able to prevent the virus from scoring against us. So we're reopening. This is the offense. However, our guards should be kept in the same attitude, okay? And it should be strong enough to protect us from getting scored from the virus. This is going to be the best way to open safely. So we're going to reopen. Keep social distancing, do all the mitigation procedures, cleaning, disinfecting, cover face, like mask. And this is, we're gonna touch on the mask down the road, but mask is it's a wonderful tool to prevent the others from catching the infection.
Yeah, that's a great point. And we have to increase our vigilance in order to make this right.
Yeah, so this is here, if I know probably people that say, I don't need a mask, it's not for you. It's to protect the other from catching the infection. So we have to think about others. If you want to be part of the solution, you need to put the face mask on you to protect others. I know you're great and your immune system is wonderful, and it's not about you, it's about the society. So if you want to be part of the solution, follow these steps, and this is going to be the best way to go into these phases smoothly, progressively, and wisely, and diligently. If we don't do that, everything is going to crumble, unfortunately.
Sure.
So we need to do it safely, and everybody should be part of the solution. This is a societal duty. Everybody is part of the solution. If we don't have a collaborative effort, it's not going to work. So we are all in this together. Although we're 6 foot apart, we are all in this together. And this is how we can resume our life safely in the next few weeks.
Right. The governor's released timelines for businesses to be open May 11th. Yesterday was they opened up about 7 or 8 industries, vessel dealerships, cars, automobiles, boats, RVs, and stuff like that. There are, however, very strict guidelines. We talk about the guidelines where everything's got to be sanitized after every use. It's going to increase costs. It's going to increase opportunities for people. Is this feasible for small businesses at this point to reopen this way?
I think it is, Jeff. I mean, we've got 33 million people out of work in this country. We've had to make layoffs between the Pike County Fiscal Court and the jail because we were already in pretty tight financial circumstances. We've had to make layoffs, almost a quarter of the county workforce between the fiscal court and the jail. Not something we wanted to do, not something, no one planned on being in the middle of a pandemic when the national economy was booming. And if we don't put people back to work, I mean, we could be looking at the second Great Depression. And the only way this works, as Dr. Fadi and Tammy have said, is if people do their civic duty and comply with the guidelines. And Governor Beshear, I want to say this about the government officials, health department, Dr. Fadi. The reason that we have only had 23 cases in Pike County is because of our rural nature, and a lot of people have adhered to the social distancing guidelines that were put in place. As we roll those back, if people don't adhere to the rules, don't do their civic duty, we're going to be right back in the middle of a surge that could force the governor to have to put these restrictions right back in place. And if that happens, there will be permanent damage to the economy that we may never overcome. I do believe that these rules that the governor has put forth are very reasonable. My business will have to comply with those. There are industry-specific rules, like for healthcare providers, on May 6th when they allowed outpatient surgical procedures to resume. We have a list of all the requirements for across the board, the general rules, and we also have other rules that we can provide. They're on the kycovid19.ky.gov website. We can provide those too. There are specific rules for places of worship that took effect on May 9th. As you mentioned, construction projects, horse racing, no fans available, manufacturing and distribution, office-based businesses, pet grooming and boarding, photography and vehicle or vessel dealerships. Those took effect yesterday. May 18th, government offices can reopen. We are working on a plan to be able to reopen the courthouse for limited access, implementing the rules the governor set forth. May 20th, there will be specific rules taking effect for funeral and memorial services, and we will provide those to all the funeral homes. We're going to send a letter out today to provide those to our funeral homes. So I've had calls, Jeff, from people who've lost loved ones. Is there anything we can do? And it's heartbreaking to lose a loved one and only have 10 people at the funeral. Drive-by visitations. Have a friend's mother who passed away, and they did a drive-by visitation. Very traumatic on families, and so we want people to understand what the rules are there. May 22nd, restaurants can reopen 1/3 capacity and outdoor seating. May 25th, Jeff, you'll be able to get a haircut because cosmetology businesses, hair salons, barbershops, massage therapy, nail salons, tanning salons, and tattoo parlors will be allowed to reopen. And then on June 1st, fitness centers, movie theaters, June 11th, campgrounds, June 15th, some child care and youth sports, and then July 1st, bars and groups of 50 or more people. I personally have concerns about groups of 50 or more people because if we're still seeing cases periodically.
This is all subject to change. I mean, if at the end of June we're still seeing cases, I'm sure the governor's going to say, listen, we're going to push that back to July 30th or even August 1st of the 50 more. Do you think, could you see that being an option?
Yeah, and that's what I've said. If people don't do their civic duty, or let's say people are doing their civic duty and we start seeing a surge in these cases because people are getting back together, they're going to restaurants, they're going to other businesses, I fully expect that these restrictions would have to be put back in place or some form of restrictions. We know, and there's been a lot of misinformation about this virus. I want to just say that, people are saying, well, I think I had it in December. As Dr. Fadi said, this is something new. There's a lot that's not known. We don't know fully what to expect. A lot of the modeling has been off by the epidemiologists. We've heard estimates of 200,000 deaths, and they lowered it to 60,000. Well, nationally, we're at 80,000 deaths, or a little over that. So there's still, this is a dynamic situation, and the public needs to understand that these things are subject to change. We are not going to be, even after May 18th, in a position to reopen the county's parks and public facilities. And we took criticism for that, but there's a reason that we only have 23 cases in a county with 58,000 people. And I think it's because the social distancing's worked. The health department's done a great job of educating people and enforcing those regulations. But when you come right down to it, Jeff, there's no way we can enforce all these rules and regulations for every business and every individual in Kentucky. It comes down to people doing what's right.
Personal responsibility.
Personal responsibility. I'm a big believer in personal responsibility. And, the governor.
That's a conservative type of approach.
I've been accused of that on occasion. The people should take responsibility. The governor has taken a lot of heat from people showing up with assault rifles, and
that solves nothing, though. At
that
this point,
solves
doesn't it?
nothing. I mean, people have a right to protest, but to heckle the governor, and I had concerns over the limiting church congregations' ability to have services. My grandfather was a Baptist minister in this county for 50 plus years, but it was done to protect the public. And as I said earlier, one thing this doesn't talk about is what happens with our public schools. If we have 10-year-olds on ventilators, we're going to have to take our school boards, both at the Pikeville Independent Schools and the Pike County Board, will have a very hard decision. Do we put kids back in the classroom in July or August? And if we're still seeing cases, and having 3 kids, it's not possible to teach them proper hygiene. No matter how much you tell them to wash their hands or keep their hands out of their mouth, that doesn't happen. And they congregate with each other, and it causes me a lot of concern. One thing, if you look at these numbers, the way it broke down, Tammy gave me the data of the 23 people in Pike County who had this disease. 5 were in their 20s, 2 were in their 30s, 2 were in their 40s, 4 in their 50s, 4 in their 60s, and 6 in their 70s. We don't have any in teenagers or preteens. So you can expect, and the reason is schools stopped class before we started seeing cases here. You put these kids back in schools, you're going to start seeing kids in their teens and preteen years with this virus.
And also, I also believe that because of, moms and dads have really been doing a good job of locking their children inside and not letting them go out, has been an added barrier for the protection of the children. Now, on the flip side of that, I've been told that in the county, wine sales have gone up exponentially. So in 20 years from now, our country's going to be run by children who are homeschooled by day drinkers, but we'll get into that some other time. Ray, we are experiencing a huge lack of income. The county has got, you've had financial issues prior to this from, years and years and years of neglect. In comes COVID-19, in comes the lockdown, in comes the lack of revenue. How are you not pulling your hair out, number one? Number two, is money coming in from the federal government to help shore up the county's reserves? And once people start getting back to work, is that going to help, or are we at a level where it's just too far gone?
Well, I'm glad you brought that up. I was sort of criticized for talking about the county's finances at one of the other press conferences, but it's affected businesses. The county, as I mentioned earlier, was already on shaky financial footing. We've lost, between 2010 and now, the county's lost over $11 million a year in coal severance and mineral severance tax. And the occupational net profit tax that the prior administration put in place only recouped about $3.6 million of that. In the next budget, we are anticipating we were $640,000 short in coal and mineral service, below what we budgeted this fiscal year. We figure we're going to be $1 million next year below this year, increasing costs like health insurance, workers' comp, liability insurance. The day we made the layoffs, we found out 2 very, very disturbing things. We were losing about $500,000 at a minimum in county road aid. And that county road aid money we get from the state. It's a formula The reason we're losing county road aid is that the road fund is funded in large part by the gas tax. When you buy gas, 26 cents a gallon goes to the state. People aren't driving. There's a stay-at-home order. Businesses are shut down. The state doesn't have the money to pay us what we were previously expected to receive. We're going to lose blacktop money, we've been told up to $200,000 a year. We have planned on a potential impact to the occupational net profit tax of $500,000 to $600,000 alone. So when you look at all these pieces and you start putting it together, that's about a $2.5 million hit. The budget we just will pass out at the next court meeting will be about $2.5 million less money spent by the county than the budget we're operating under now. And those are circumstances that this court didn't create, but we're gonna make sure we provide the best service.
You have to deal with it. And you're saying less money spent only because you have less money coming in.
Well, you have less money coming in,
Right.
and your costs are going up. So those two things together result in a decrease in your base budget.
Will the economy opening back up and putting people back to work help with the occupational tax and net profit tax? I mean, it could be considered a drop in the bucket, but will that help not only immediately, but 6 and 12 months down the road?
The next budget takes plans for a $600,000 hit to the occupational net profit tax. The earlier we can get people back to work, the less that damage will be. The problem is, Jeff, I'm not sure how long it's going to take a lot of these businesses to recover.
Right.
There are some businesses that simply will not be able to withstand being shut down for 2 months. And trust me, I understand the impact of people who've been put out of work. And we still got people who applied for unemployment in March and in early April that still haven't received a check yet. The system was not, Kentucky has the highest percentage of unemployment claims per capita in the country. A third of Kentucky's workforce has filed for unemployment. That should scare everybody.
And the filing system that Kentucky uses is one of the oldest in the country. So not only did the entire country get bombarded, each state, the fact that Kentucky's antiquated unemployment system didn't help the fact to get the necessary help to the people who filed.
No one would expect to have nearly 700,000 claims for unemployment insurance benefits in 2 months. And having served in the legislature, you know, one thing I hope and pray that comes out of this is that the state and federal governments both will be better prepared to deal with a pandemic. This is not, we had the 1918 pandemic, and I've mentioned before, my great-grandmother passed away from the Spanish flu. My grandfather was, I think, 6 years old. You know, we went 100 years between pandemics that hit this country. We can't take it for granted it's going to be another 100 years before this happens again.
Right.
I think that would be, we don't know what the next, there could be a virus that comes out that's much worse than COVID-19. I think we need to be prepared for that. But the earlier we get people back to work, Jeff, the better off we are.
You mentioned the rules. Are the rules, just for the folks watching and listening, are the rules on the county? Did you put the rules and opening on the county's website?
We have not yet. They're on the
Let Tammy answer.
Yeah,
Tammy,
kycovid19.ky.gov. And then you
Fantastic.
scroll down to the bottom of the page, and it's a Healthy at Work link. It's near the bottom of the kycovid19.ky.gov website. Scroll down to the bottom, click on Healthy at Work, and there, I mean, you can go down a rabbit hole, but there's just an enormous amount of information there for each sector of society and the economy.
Yeah, I think we've linked all that stuff to our websites as well, so that's a possibility. You know, you all mentioned the jail. Miraculously, in Pike County, we haven't had any cases in the jail, and all over the state we're getting cases. Can anybody explain what's happening at the jail to prevent this? And the job that the jailer, Brian Morris, is doing?
I think Brian has done a fantastic job. Brian, Jason Fields, and the other administration at the jail they've done a great job. We've worked with them to make sure that they've got what they need. Our safety director, you know, it's interesting too. We've not had any in our county workforce, and we've still been able to pick the garbage up. We've had a 40% reduction in manpower. We're still picking the garbage up. We've had to, in 2 months, less than 2 months, we've had to completely redo the solid waste routes that have been in place for 20, 30 years. and it's working. We're having a lot fewer glitches. We've had to have some overtime cost that we've incurred. But, you know, if you look at what the Green River Correctional Complex has had over
Right.
300, 400 cases, 3 deaths, the Federal Correctional Facility in Lexington, the medical facility, has had a substantial number of COVID-19 cases. We've not had it in the Pike County Detention Center, and we're very fortunate, and I think Brian's done a great job. And let me tell you, that would be, if we've got 300 plus inmates over there, plus staff, if we had COVID-19 to break out in the Pike County Detention Center, it could have a catastrophic impact on the county's bottom line.
Sure, I can imagine.
Not to mention the risks to the inmates
And staff and everybody else.
I think also, Jeff, the same thing also for long-term care facility here in our area, nursing home. So we have only one staff with COVID-19, and we have no single case of fatality from our nursing home resident. And this is related to the robust infection control policy that we're doing in the nursing facility, from testing anytime they come to us. We make sure that in COVID-19, we are running very meticulous and very robust infection control policy inside these facilities, limiting visitors and non-essential people, and try to test as frequent as we can. So all these mitigation measures are playing a major role in preventing this infection from coming to these facilities, because having one case inside these facilities will have drastic consequences. So we're so blessed so far we don't have that much activity here in the nursing home facilities.
I think it's because of the aggressive stance that the personal responsibility we talked about people are taking to make sure that they prevent this. All right. You know, we hear a lot about the 5 C's, and, you know, the health department came up with this with Dr. Fadi and everybody else. Tammy, you know, I understand there's another version or a caveat to the 5 C's. Can you talk about the 5 C's, what they are, and how people should adhere to that?
Well, sure, and we know the 5C plan really well, and Dr. Fadi worked very closely with their original COVID task force. Early on in March, we came up with the 5C plan, and I really find it interesting that those 5 C's hold as much water, as much weight behind them today as they did then. Would you not agree, Dr. Fadi? We did tweak it slightly for the cloth mask covering, but I do talk about do your civic duty, and that's keep that respectful. You're showing a sign of respect when you remain 6 feet or more away from others when you're in public. It's a way that you show that you love your community and you love your family and your neighbors, but also remain calm and get your information from reliable resources like individuals that are on this forum, your county government, Pikeville Medical Center, media that you know and trust, the Pike County Health Department, kycovid19.ky.gov. Remain calm, get your information from reliable resources. Clean, we talk a lot about clean. If I had to pick one, probably social distancing would be probably the number one sharpest, strongest tool. But second would be clean. Clean your hands twice as often, twice as long. And then use the high alcohol content sanitizer if you can't get to water and soap. Clean high traffic areas like this desk in front of me. This is a non-porous hard surface. You know, if you're touching it frequently, I try not to touch. I have the habit of keeping my hands to my side now. I don't touch my face or objects as often, but clean those areas. And then also cover. And the cover, originally we talked about cover your cough and sneezes with tissue and discard. Of course, you would still want to do that if you were home. But when you're in public, it is your civic duty. It's your social responsibility. It is being a good neighbor. It's being a good Pike County citizen. We're all in this together. We go to church together. We shop together. You know, we live amongst each other. I would not want to do anything but just show my love and my concern for my neighbors and everyone in this community by covering my face when I'm in public, because I'm not protecting myself. I'm showing an act of love and kindness to others because I'm protecting you from me. If I cough or sneeze, those droplets would stay mainly inside my covering. So we tweak cover to cover your face, show your sign of love and respect. And then, of course, contain. If you've tested and you're symptomatic or you're symptomatic, stay home if you're sick, contain yourself. If we stick to those 5C plans, we can continue with the phases that the state has introduced to the economy, and we'll be able to just clip along those phase 1, phase 2, phase 3, all the way to July 1, and we'll all be watching 4th of July fireworks, hopefully at a good social distance, but we'll be able to have some normalcy until treatment or vaccine is available.
Very good, thanks. You know, we talk about wearing masks. You know, I have my bandana on, and I want to talk about how to properly wear masks. I see people wearing masks like this, and I think that defeats the purpose. We also have these disposable masks. Let's talk about, you know, where should you be wearing masks? What kind of masks? Cloth versus cotton, proper fitting. Can we reuse them? And, you know, if I take this mask and I put it over my blower here, and I'm out in the public and somebody has sneezed and slopped all over me, and I put this back on my gear shifter in my car, and I get out and I go to the next place and put it, am I trying to, will I be in danger of infecting myself because this mask may have COVID on the outside and I'm touching it and putting it all over my face? Doc, can you want to talk about that?
So I'm gonna split that into two different aspects. So when you deal with the healthcare, you have different setting compared when you do in the public. So in our facility or any kind of like institution, we have different kind of like masking policy. We do surgical masking mainly, which is 3-layer, very protective, and we have basically preservation policy to keep the mask for probably few days because we need to keep most our resources when we have really a lot of cases. When it comes to the public, cloth mask is definitely a good option to deal with because that mask is creating a physical barrier for you to prevent all these secretion from being pushed in the air and go to somebody else. And this is basically the benefit of that kind of like mask. So cloth masks or any kind of mask are physical barrier. However, you have to make sure how to deal with these masks. Touching the front of the mask is dangerous because all these viruses and bacteria will be filtered through the front because you're gonna breathe through that. And touching this area and going back again to your eyes and your nose and your mouth, you're gonna do what's called auto-infliction. So you're gonna auto-infect yourself. So you have to be very careful about dealing with a cloth mask. These masks should be washed daily basis, and you cannot handle them from the front side.
So with a cloth mask, we want to wash them on a regular basis.
Absolutely.
Disposal masks, we want to do what they're supposed to do, is throw them away and use another one.
Unless you're in a hospital setting, there is a certain policy how to preserve that, but this is gonna be up to professional, not
Yeah, this
something
is
to
the general public that I'm talking about. And we want to wear them when we're out in larger places like the box stores, the grocery stores, and so on and so forth. We want to be able to cover, to contain ourselves.
I want to emphasize on that social distancing is still the strongest weapon. And these masks are just adjunctive methods to enhance the mitigation process. If you can keep yourself within 6-foot distance, then mask shouldn't be wear. So it's not a problem. But if you cannot protect that kind of 6-foot distance, and you're in a place like Lowe's or Walmart or any other place, when it's very difficult to protect that 6-foot distance, definitely a mask is gonna be a great tool to protect the others from you and protect you from the others.
So even if you are 6 foot away, a mask probably wouldn't be a bad idea because somebody could be sneezing down the road and the cough of the ferocity of a sneeze could put those droplets out there, and you could be protected if you are bundled up correctly.
But again, going back to the point, that mask doesn't protect you from catching the infection if you're in close proximity to others.
Right.
So initially, I want to emphasize on that 6-foot physical separation first. You need to maintain that first, and definitely having masks on the top of it is going to be an adjunctive tool to protect the others and you from having the infection. So if you combine both together, definitely the outcome will be better.
Ray, we have, if you go to any of the stores that are open right now, grocery stores, Lowe's, Walmart, Food City, hell, even the liquor stores, they have spacing 6 feet apart. You have people out there, employees who are wearing masks. What does a consumer do if somebody is not practicing that social distance? Somebody is not 6 feet apart, the stores are not doing that, they're not washing their hands, they don't have the plexiglass in front of everyone. What should they do?
Well, first of all, I would bring it to the attention of store management. We've taken the position that, you know, we can't police every store in the county. We have 2 Walmarts, 3 Food Cities, a Lowe's, a lot of high-traffic people in those stores, plus other stores. It is up to the store management. Now, even though the governor is rolling back some of the restrictions, other restrictions are still in place, the 6-foot social distancing, limited crowds in the stores. If the stores are not complying, they can be shut down by the health department. And if you take this to the store management and people are not complying, it's obvious in the store that they're ignoring these things that have been put in place, then you need to contact the health department, because the environmentalists at the health department have done a wonderful job of going out to not only police these stores, but to educate the store owners. Nobody, let me say this, it's not the fiscal court's intent, it's not the health department's intent, I don't believe it's Governor Beshear's intent to shut down businesses that we need open. People need to be able to get, parts for their appliances that may go down. We could question whether you need to be in the home and garden section buying petunias, running all over top of each other, putting people's lives at risk. But, your food sources, gun stores have stayed open. People have a right to go to those stores, and we want to keep them open, but they have a responsibility to comply and play by the rules.
And the last thing we want is we want vigilantes out there trying to enforce rules and regulations that they are not qualified to do. We saw down in Georgia where these two guys the two white guys shot a black man because they were being vigilantes. They took the law in their own hands. We don't want that happening here. The rule of thumb is if you see social distancing rules being broken or guidelines being broken, call the store manager. If that doesn't work, call the health department. If that doesn't work, call the police or the fiscal court.
This is really not a law enforcement function. This is a public health function. If the best enforcement mechanism we have is the health department, and I want to speak to the men and women of the Pike County Health Department. They have done a fantastic job. And the reason we only have 23 cases is in large part due to the work that they've done to educate the public and to enforce the rules that have been put in place. I want to say this again, nobody wants to impact a business that's already struggling. We have a lot of small businesses, I said, will never make it back. But businesses, when they come back online, it's imperative that they comply with these restrictions, because if we end up with a surge where we start seeing a substantial number of new cases, and these restrictions have to be put back in place, even temporarily, the impact of some of these businesses will be catastrophic. I've got a lot of friends who've been out of work. I've got, whether they're hairdressers, we've got people that have been, medical providers that have been furloughed, hospital furloughed 200. The biggest employer in Pike County, Pikeville Medical Center, furloughed 200 employees. When you see that type of financial impact happening to your businesses, it's very concerning. ARH has furloughed employees. A lot of these businesses, even restaurants that have been able to do curbside, have had to lay off all their servers, their dishwashers. And it's really taken a toll on a lot of families, and that we need to, the civic duty component is important, because we need to keep in mind, if we're not doing our civic duty, we're not playing by the rules, we're hurting other people. People we may never know, but we're hurting our community, we're hurting a lot of innocent people that are trying to just get back to work, and we can't afford that.
At the end of the day, it's about loving God and loving your neighbors. And violence has no role in solving that problem. So I know that COVID-19 has created massive destructions to economy, public health, to well-being, to everybody, and implanted massive fear as well. So the violence won't solve the problem. So we need to be responsible. We need to treat each other respectfully. And like we just woke up a few weeks ago in a different ward when giving hugs and shaking hands were weapons to spread the infection. And at that point, we used to say that not visiting an elderly or vulnerable one was an act of love. We cannot move rapidly to a different lifestyle. We have to do it very progressively. However, it is normal to have different opinion. We have to respect each other. We have to accept each other. We need to talk about science. So we cannot bring, at this point, violence. Violence will not solve the problem. Let's be respectful, and this is how we can solve the problem.
Jeff, can I say something?
Sure.
As you know, I'm probably as pro-gun as any politician.
Yes, sir.
And it is an embarrassment to me as a firearms instructor, as a somebody who has an A+ rating from the NRA, or what I did when I was in the Senate, and to see people with assault rifles parading outside the state capitol, whether it's here, whether it's Michigan. People have a right to protest, but as a law-abiding gun owner, that sends the wrong message, and that really turns people against law-abiding gun owners. And it doesn't solve anything. It doesn't get people back to work. It doesn't stop the spread of this disease. And like Dr. Fadi said, our first duty is to God. And we all need to be praying for these people who have been impacted. I put a post up this morning asking for people to pray for that little 10-year-old that's on a ventilator.
Sure.
It could be my 11-year-old. It could be my 5-year-old. It could be my 14-year-old. And we don't know who this is going to impact, and we all are in this together. Whether you agree with the social distancing restrictions or not, we're all in this together. And we owe a duty to our fellow Pike Countyans to listen and to adhere to these restrictions.
If we could shoot and kill the COVID-19 virus,
Be a lot easier.
by God, right here in Pike County, it wouldn't stand a chance. I guarantee you.
It would have been over a long time ago.
That's right. Ray, we talk about food shortages, or we hear about food shortages. They've shut down processing plants, the 4 major ones in the Midwest. Have we been in contact with local grocery stores to make sure that there are going to be food shortages? And also, when this thing happened, for some strange reason, people went out and bought all the toilet paper and sanitizer they can get their hands on. And I'm sure there's some raw butts around here somewhere, because there's no possible way you could do that. Have we talked to the grocery stores about limiting beef and meat and chicken and stuff like that?
Doug Tackett, our emergency management coordinator, I gave him instructions to call weekly. There are some sporadic issues, but I have been personally to some of the local grocery stores, and there is meat there. There are issues where there may not be as much that you would have seen before the pandemic. We have been advised that there are some intermittent shortages, but nothing that is alarming at this point. I don't think that we fully know with Smithfield Meats and Tyson and other companies that have been impacted. We may not have seen the full impact of that yet. But as of right now, no. Kentucky seems to be in a little bit better position because we have a pretty strong agriculture industry in Kentucky, and we've been able to fill a lot of those needs right here in the state. I did see a good piece of news that Charmin has announced that they have massively increased production. So
Exactly right.
we do encourage people not to panic buy. I think people should see by now. I'm really a little bit upset that you've got people spreading conspiracy theories, Jeff, and I want to address this because I think it's my responsibility as county judge and somebody that's lived in this county for 50 years. Never, other than college and law school, I've never lived anywhere else. The simple fact of the matter is this is not created. I think Fadi would tell you that science tells it's not man-made. It's a naturally occurring virus. These restrictions were not a way to start the liberal left from, to declare martial law. Back in the 1918 pandemic, social distancing restrictions were put in place even then when we didn't know a lot about viruses. This is a public health issue. It's not a conspiracy. I think there's a lot of misinformation about hydroxychloroquine and Plaquenil. There's people who think if I get this disease, they've got that drug available. I mean, and as Dr. Fadi said, there are some anecdotal studies, but there's no study out there that shows that this really works. And, if you had cancer, would you bet your life on a chemotherapy drug that has not been proven to work in the scientific literature? You wouldn't do that. You wouldn't take something besides insulin to treat diabetes. I mean, a lot of conspiracy stuff out there. I would encourage people who are on social media, I see all this stuff posted on social media. It's just outright lies. And people post it, repost it, share it, and it's not true. And that is really undermining the efforts of Tammy and Dr. Fadi and our elected officials who are trying to keep people safe and get people back to work. We want people back to work.
Yeah, that's a good point. Speaking of food, we see mile-long food banks all over the country. Are you getting any calls about, and even from your perspective, Tammy, are you getting calls about shortages of food at local food banks? Are people able to give to the food banks, and are we seeing anything like that?
Jeff, I've not had any calls. We've had some people that we have sent to our community services director, Diana Thacker, people that we've sent to various government agencies for assistance. Greg May, who runs the ARC nonprofit, Greg, out of his own pocket, has bought thousands of dollars of food for their nonprofit, and given it to the schools. I want to thank Reed Atkins, Jerry Green, both boards of education in the county and city, because a lot of these kids who were dependent on the meals that they get at school, teachers, school officials, cooks, they've been preparing meals and taking them to these needy children around the county to make sure that they've got food. And, you know, that is a testament to our educators. It's a testament to our school administrators. And we need, and Greg has helped work to make sure that the county schools have been able to continue to do that. And I want to thank him. A lot of people are working to make sure that those in need are taken care of. And if there is someone out there that has a food shortage, this Rodney Scott, somebody I want to speak highly of. Sheriff Scott, his deputies have been taking food out or going and getting food and medicine to people who can't go out and get it. Our churches have stepped up big time. And if there is someone out there that has those types of issues, if you'll call the judge's office at 432-6247, we'll get somebody to help you. We've even had county employees that have gone out and helped with our senior citizens. Our senior citizens program here in Pike County has continued to serve meals at home to those residents who were already getting home delivery and those that were typically coming to the senior citizen centers. They made a hard decision to shut down 2 centers because of declining attendance and because of their budget situation. But all of those people served by Phelps, which was a nutritional center, not a senior citizen center, and the Maribone Center, as well as the other 6 centers that have been temporarily shut down, all those senior citizens have had their meal delivery remain constant. And we've had to take some county fiscal court employees out of their normal duties to go help make sure those meals are delivered. And I want to thank them as well.
It'd be a nice.
Also, Cuffs and Hoses, they're doing a great job as well.
I'm sorry?
The Cuffs and Hoses also,
and
they're doing
Hoses,
a great
right.
job in delivering meals. And
Sure.
Chris Edmonds doing a really phenomenal job in helping these kids with delivering meals at this point.
It'll be a really nice idea. We're hearing, stimulus packages, billions and trillions of dollars. What would be the downside, and I don't want to get political, but what would be the downside if the federal government opened up every restaurant, put every employee back to work and said, okay, you're going to go ahead and feed, 2,000 people this week in Pike County, and you're going to feed the folks in Phelps over at Paul's Pizza out there in Phelps. We're going to give you a stimulus package to feed all those folks who can't make it in, and, Bank 253 or Domino's Pizza. That would be, giving money, buying stuff locally, buying that produce that our farmers are throwing away, the milk that is going down the drain, buying that stuff back to federal government, give it to these restaurants so we can feed the people. So I don't want to get political, but talking about restaurants, Tammy, are restaurants still safe to go and get curbside or takeout?
Absolutely. And what we know about this virus and what the experts have seen is that there's just very, very low risk for transmission through, if you do it correctly, which our restaurants in Pike County have. I've seen some phenomenal techniques, but with curbside and the drive-through, there's just very low risk of any transmission. I personally take advantage of curbside drive-through. Now, I personally choose to wipe down containers. I do clean containers if they're handed to me, and I clean my debit card as it's handed back to me. But there's no...
As an extra precaution.
That's extra
Right.
precaution. That's not a CDC guideline. That's just something I personally do. But there is a low risk of transmission because we talked about that sustained interaction. So when you're going through a drive-through, if someone's just handing you, a package and you drive on, or if it's curbside, they come out to your window, they hand you a package and they walk off. Or someone delivers a pizza to your door, they sit it down and they walk off. That is not sustained interaction. The likelihood of my exposure to your droplets, correct, Dr. Fadi, or if you touch something, there's no interaction. So the risk is just very low, and curbside and takeout remains a viable option. I personally take advantage of it and encourage others to take advantage of it.
It also gives people an opportunity to get out of their house for 10 or 15 minutes and
It's
drive
good
through.
it's good for your soul. It's good for your
soul.
mental.
So Jeff, complying with respiratory etiquette and mitigation measures should be part of our routine life. So if I'm cleaning a debit card, because we know that the virus can stay alive for a few days, So when we keep our shoes outside the house, this is basically safe for the family. When I clean my hands, when I cover my mouth and my face, these are important measures to prevent the spread to others. So they're gonna keep me safe and keep the others safe. So we need to practice our social duty and make sure ourselves are fine and also the rest of us are fine as well. So all these are very helpful to prevent any further spread, and we'll be able to resume life safely.
Sure. Guys, we've covered a lot of ground here. I know we've taken up a lot of time, a little over an hour and a half. Let's try to wrap this up. Let's talk about, keeping our good mental health attitude. What do you suggest we do to maintain? Is it going for a walk in the park? Is it going to do something different? How do we keep sane through this thing? How do we build our spirits back up? How do we go back to work responsibly? How do we rebuild our economy? If it is to be, it has to be with me. It starts with me. So kind of, I'll give you guys a few minutes to just kind of talk about, wrapping this up, talking about going forward and moving on. Tammy, we'll start with you.
Well, for me, it's different for everyone as far as like your mental health, but for me, it's running. But for someone else, it may be gardening or just going out and shooting your gun, Judge, as safely and appropriately. But for everyone, it's something different, prayer, meditation. I run and I get all of that in at one time, but so I've gotten a few more miles in lately than most people should probably be doing. But whatever it is for you, try to continue normalcy best you can. But as a society, as a community, what I'm asking is to continue to test. Go test. If you're reentering the economy, the workforce, go test. If you're going to be exposed or you feel like you've been exposed, go test. So let's test so that public health, if you test positive, then we can have you temporarily quarantined, removed from exposing others, and then everyone else can go about their life, and we'll continue to test, as Dr. Fadi talks a lot about contact, trace, lock those individuals down so that we can box it, as he talks about boxing it in. So go test, and then find that thing that helps you get through this. I mean, there will be an end. We'll get there.
Very good. Ray, parting words?
Well, I can tell you my deputy judge and I both had blood pressure problems in the last 2 months.
I can only imagine.
One of the issues, Jeff, is, find something you like to do. Try to find some time away from it. And it's hard because it's all over the news. It's all over social media. You pick a newspaper up. You pick a magazine up. I mean, you can't even turn on ESPN without hearing about COVID-19. You have to make the best out of the situation. You mentioned earlier about, federal aid. There's no federal aid on the horizon at this point for local governments. We have to make the best out of the situation we're in. The state got $1.7 billion. None of that money's going to come down to us. Congress or Senator McConnell has made the statement that, we need to let states file bankruptcy. That would be a catastrophic thing to happen because basically every teacher, retired trooper, police officer, mine inspector lose their pensions, lose their health benefits. You hear that kind of news, sometimes you just have to turn it off. What we've tried to do, what the fiscal court's tried to do is, look, we're taking the facts we have, we're taking the financial situation we have, we're doing the best we can. We're still continuing, we've been able to continue to run county government. There's a lot of positives. There's a lot of positive things that we think are going to happen for Pike County going forward. We're going to get the first industrial site up and running next year. We're going to put a significant investment into our trail system of economic development dollars that are earmarked for economic development. There's some good things on the horizon for Pike County, and I think one of the silver lining in this cloud is it gives us an opportunity. If our numbers stay down, we prove that this area is immune from the impact of the pandemic, like in New York or California and other places. Gives us a great argument to try to bring businesses here, whether it's to make personal protective equipment, whether it's to make hand sanitizer, whatever it may be. We've got to stay positive. We've got to play the cards that we're dealt, and we've got to try to move Pike County forward. It doesn't do us any good to go on Facebook and complain or, have a negative attitude, bashing people for decisions they made. When you're in a leadership position, you have to make hard decisions. And I knew coming into this job that there were going to be hard decisions that I had to make. They weren't going to be
Never like this.
Well, I knew they were going to be hard.
No, I mean, the COVID
No,
decisions you're making now.
this was just throwing gas on a
Right.
already smoldering fire. But we can do better. We can move Pike County forward, but you can't fix it if all you want to do is get on social media and complain. If you don't, my theory is, if you go on social media and you've got an idea about how to move your community, your state, or your country forward, post that. Tell us what we can do better, how we can move the county forward. But to go over there and bash politicians or to go over there and just constantly criticize, all it does is it perpetuates this poor mindset, this
And negativity.
When you've got Dr. Fadi has even been on TV talking about the importance of a positive attitude. That when you're constantly negative and all you read is negativity, it impacts a person's mental health. I'm convinced of that. I look forward to Fadi talking about that. We've got a lot of people in this community with mental health issues already. Depression, anxiety, people who are dealing with health problems, people who are then throw on the financial problems from the pandemic or the loss of coal jobs. The only way we can fix this is to stay positive, look for ways to move our community forward, and I think we can do that. It's not going to be easy. There's going to be hard decisions to make. But people need to understand, when you go on and all you want to talk about is negative, it doesn't do anybody any good.
Yeah, well, you talk about positive stuff. Today's front page of our paper, we have graduation ceremonies from kindergarten to high school, and that's, it's an uplifting thing. We get tired of publishing the negative stuff on a regular basis. There's good out there. We're searching for it. Dr. Fadi, can you give advice on staying well mentally, emotionally, spiritually, physically?
So first, we need to continue to focus on positive message. So this is the point, as our faith is about hope and about we're doing what's right. So the other thing that all the leaders here in the community are doing a great job. So we're working together to deliver the right message for public. We've been very transparent since day number one. Pikeville Medical Center leaders, Donovan Blackburn, Aaron Crum, Tammy Riley, Judge Jones, everybody here in the community been stepped up big time to help this community. And since day number one, we said that the top priority here is the safety of the community. And this is what we've been doing since day number one. It's about how we're going to be remembered down the road. So we are doing exactly what's needed and what's benefit the whole community. So talking about mental health is very important, because here you need to accept the fact that we have COVID-19. If you don't accept the fact, you cannot deal with the situation. And we know that COVID-19 created a lot of stressful situation, a lot of destruction in economy, in well-being. And now we have too much anxiety and depression. So our job here is to improve our resilience and put down our anxiety. And how to do that? This area is beautiful. It's very scenic. So you can walk, you can exercise. You have plenty of time to do that. You can pray. You can even socialize. I think this is the perfect time to take advantage of all the electronic devices and all the invention in electronics. You can talk to somebody over the phone. You can do FaceTiming or Zooming. So losing that physical contact doesn't mean that you're losing your friendship and your social life. So losing that physical contact with church doesn't mean that you're losing your relationship with God. So a lot of things that you can do to keep increasing and improving your resilience. So take advantage of that, and hopefully down the road in a few months, we'll be back to our norms.
Eat healthy, get exercise,
Eat
get
healthy
rest.
is very important. Eat healthy is very important. So try to not fall into the trap of eating junk food and artificial sugar. This is extremely important, because all that kind of food is going to weaken the immune system, is going to make you much more prone to catch infection, will be vulnerable to other infections. Exercise, mentally stay alerted and stay fine, and try to treat everybody well. Take care of your family, your kids, work on their well-being. Try to have a goal in your life, especially during that time. Let's say I want to lose 10 pounds during that kind of period of time, and achieve that goal at the end of the frame time. So try to have goals in life and try to achieve these goals. I know these are very unprecedented times. Never had these kind of experiences before. However, we can go through it. And I said all the time, together, we can defeat COVID-19 and we can bring our community stronger than ever. And we have to be nice to each other, and we have to be kind to each other. This is how we can defeat COVID-19.
Very good. Guys, thank you very much for your time. Appreciate your hard work, your effort. Thank you for watching, listening, staying with us for this long period of time. It's vitally important that we continue to stay healthy. It's vitally important that we continue to be personally responsible and become, as Dr. Fadi said, part of the solution, because you got people out here working their tails off to make sure that we rebuild our economy, make sure that our local government is there, making sure people stay healthy, making sure rules and regulations are followed. So on behalf of the Pike County Health Department, Pikeville Medical Center, and the Fiscal Court, thank you very much for watching.